Welcome to TCN Talks. The goal of our podcast is to provide concise and relevant information for busy hospice and palliative care leaders and staff. We understand your busy schedules and believe that brevity signals respect. And now, here's our host, Chris Comeaux.
Hello and welcome to TCN Talks. I'm excited today. Our guest is Cordt Kassner. He's a PhD, a publisher of Hospice and Palliative Care Today, and he is the CEO and founder of Hospice Analytics. Cordt, welcome. Good to have you.
Thank you. It's great to be here.
In a second, I'll talk about why you're here, because you're going to be here quite a bit this year as Mark Cohen has kind of rode off into the sunset. But what does our audience need to know about you? You've got a great background in hospice and palliative care, so share a little bit of that.
Oh, thanks, Chris. I appreciate that. I mentioned in the past, I'm currently the CEO of Hospice Analytics, a research company designed to improve access to high-quality hospice and palliative care. That's kind of the quantitative side of my brain. And then as publisher of the Hospice and Palliative Care Today newsletter, that's the qualitative side. So I love bringing these together to improve access to high-quality hospice. Prior to these roles, I was the CEO of the Colorado Hospice Organization, and prior to that, doing research at University of Colorado.
How, and then I never asked you that part of your story. So University of Colorado and getting in this space of hospice. I know Gene Kuttner, I love Gene. I still remember sitting at the table with Gene at National Hospice Work Group. But what, is there a story there? Like, how did you get into the hospice part of it?
You know, my background is actually social work, and I have a master's in counseling from Denver Seminary. And at that point, I started working at University of Colorado clinically in the Department of Psychiatry. So I was a counselor on the inpatient units for several years, and then got into research, testing all the atypical antipsychotic medications. From there, with a research bent, I was on the ethics committee and met Gene Kuttner, who's absolutely amazing. And she was opening up a new position doing research with hospice. And so I was able to shift into that position and loved it ever since.
I'm so glad I asked you that, Cordt, because I'm sitting here thinking, I've always appreciated you. You're a bit of a unicorn, but now you are like a right brain, left brain unicorn with that kind of background. But then your love for data really makes you very unique. Well, that's awesome. And thanks for agreeing to do this. And so just for our listeners, this is our third year going into doing the top news stories of the month. I was taking a walk for Christmas about 3 or 4 years ago, got the idea, love what Mark Cohen was doing with his hospice news today, and thought, wow, be a great service, because Mark and I would talk frequently about, gosh, more hospice leaders need to be reading the newsletter. But what if we did a podcast where we highlighted, hey, this is what you shouldn't have missed? And then, of course, Cordt, you purchased that from Mark. It was a year ago, January, right? So 2024 was your first year. And then Mark was wonderful enough to stay on a year where we would still do the podcast. We had you a couple times, but now it's you and I going forward. So this is going to be fun. I think about the service that this is to hospice and palliative care leaders. One, there's a lot of readers that are staying on top of your newsletter. That's awesome. There's still a lot of people that need to. And so this is our opportunity to say, hey, this is what the quantitative data shows. And then from my perspective, here's what the C-suite, perhaps maybe you didn't click on and maybe you missed and maybe you shouldn't have missed it. So with that, do you want to go ahead and jump in from your perspective on the quantitative side?
Thanks, Chris. Sure. Analyzing the click-through rates for Hospice and Palliative Care Today's January news stories, we published over 400 articles that collectively received 108,000 clicks or reads. Notably, 17 of these stories each surpassed 1,000 clicks. Let's take a closer look at these key trends. The most read story, the lead story, was with over 6,000 reads, was a collection of tributes to Jimmy Carter. Since we discussed this extensively in our December podcast, I won't comment on that further here. The second most read article, How to Help People Impacted by the California Fires, garnered 4,500 clicks. Additionally, a compilation of wildfire-related stories received 2,500 clicks, bringing the total to 7,000. Given the compassion of our readership, it's no surprise that they look for ways to contribute and support those in crisis. This pattern has been consistent, whether with Hurricane Helene recovery efforts, the California wildfires, or the upcoming coverage of the tragic airline helicopter crash over the Potomac. We're fortunate to have Dr. Joy Berger, our editor-in-chief, whose deep expertise in grief and loss enhances these stories with meaningful insights and valuable resources. Speaking of compassion, several articles focused on vulnerable communities also surpassed 1,000 clicks each, including passage of the Dole Act, which expands access to care and benefits for veterans, challenges in delivering hospice care to incarcerated individuals, cancer mortality in the Appalachian region, the HAP Foundation's partnership with communities and schools of Chicago to provide grief workshops, and a heartfelt wedding dress reveal at a hospital where the bride was ensured her grandmother could share in the moment before her death. Several widely read articles in January explored significant shifts in the hospice field, including an analysis of hospice agency ownership changes and a commentary by the Alliance on CMS's Hospice Special Focus Program.
Thank you to our TCN Talks sponsor, Dragonfly Health. Dragonfly Health is also the title sponsor for Leadership Immersion courses. Dragonfly Health is a leading care-at-home data, technology, and service platform. With a 20-year history, Dragonfly Health uses advanced technology and robust analytics to manage durable medical equipment and pharmaceutical services as part of a single efficient solution for caregivers, patients, and their families. The company serves millions of patients annually across all 50 states. Thank you, Dragonfly Health, for all the great work that you do.
Beyond these top-performing stories, we published 70 articles that received between 500 and 1,000 reads. Major themes included articles centered on compassion. These consistently resonated with our audience, including a piece combining recognition of the 80th International Holocaust Remembrance Day with a profile of a Jewish refugee who was the first donor to Dame Cicely Saunders' St. Christopher's Hospice, the importance of and rewards associated with hospice volunteering, stories about caring for a dying spouse, including a particularly moving article on a child caring for a formerly abusive parent, a comparative analysis of pediatric palliative care programs in California, Massachusetts, and Vermont. As I mentioned last month, our Saturday research issues continue to be well received. I want to thank Kathy Wagner, a retired nurse and hospice CEO, who assists with our research issues. Several research issues appeared in this mid-range readership category in January, including dementia caregiving, clinical deterioration, veteran care, advanced care planning, cancer prevention, bereavement, and many more. Even as I reflect on what these top and mid-level read stories have been in January, it occurs to me how the breadth and depth of the topics we cover in the newsletter every month. It really is a broad span, and that's on purpose. From leadership issues to regulatory to waste, fraud, and abuse to hospice quality, there really is a broad spectrum of information here. Before I hand it back to you, Chris, a few unexpected trends stood out to me this month. There were several technology-focused stories covering 2025 digital projects, artificial intelligence, and ransomware threats that did not generate significant engagement. And by that, I mean 50 reads or less. While hospice regulatory and public policy stories generally perform well, they didn't receive as many clicks as anticipated this month. And lastly, taking a cue from our colleague Mark Cohen, we recognize many state legislatures are back in session. I expected to find more public policy stories addressing end-of-life care legislation. They weren't there, not yet. So perhaps this will pick up more in February.
Yeah, that would be, I think probably March, you'll start to see momentum. I just take a page from North Carolina. I think that's one of the amazing things about Mark is like things that I never thought about, like, because he's looked at news articles for so many years, he would see the leading edge of stuff and then kind of what the wake of the ship looks like after the fact. So I think that wake of the ship will probably be March or so, but good call out because they are back in session. But I think they're just getting warmed up.
And Joy and I have been talking about, lessons learned from 2024 and a full year of doing the newsletter. We're looking for those trends and patterns. When will those state legislature stories pick up? When will they go away? And one of the things that we're looking for is if we cover, for example, 6 states are proposing medical aid in dying legislation in the spring. Well, there tends not to be news coverage of bills that don't advance. So in June, we want to take a look and look back and provide some follow-up like, okay, so these bills were advanced in January, February. What happened? So we're trying to help our readers connect the dots a little bit more than just reporting other people's news. We're trying to provide some insights into it as well.
That's great, Cordt. Well, you've mentioned Joy a couple times. So Joy Berger's the editor-in-chief, works with Cordt, and again together they do this incredible service, which is Hospice and Palliative Care Today. We'll always include a link on this podcast in our show notes where you can subscribe yourself. It's a free newsletter. And then Cordt's able to do that because he's got some amazing sponsors that actually help sponsor it. And he's always looking for new sponsors as we go forward. So Cordt, you said there were 400 articles you guys flagged. So out of those, I flagged 68. And maybe to give the listeners a little bit of a peek behind the curtain, I'm reading your newsletter every day. I have a process where I am flagging them on our side. So I don't know your statistics till literally you and I are about 24 hours before a show prep. You share the stats with me. I've already identified mine. And sometimes there is overlap where I'm like, great, look, the C-suite did read these, but probably 75%, somewhere between 60 and 75% of what I'm flagging from 30 years of experience as a C-suite leader, folks have not, or it's not been at the top 50% of your stats. So I always find it fascinating. That's what's been so great. I mean, you taking it over from Mark and just adding that additional layer of the analytics and what people are clicking on. I just find it fascinating. It gives me great insight to what leaders are thinking about, clicking on, et cetera. So with that, I actually flagged 68, which is kind of a low month for me. I'm averaging about 100 per month. But there are a couple months a little bit less. And so this month it was 68. We've talked before, and I've shared with Cordt that I've got about 10 categories that are like my outline. Interestingly, those categories align with the research project that we've been doing for about 7 to 8 years about the challenges that hospice and palliative care programs are facing, which makes even more important the work that Cordt and Joy do, because that's the real-time intelligence. What's being published out in the domain? What's the research saying? It is the tip end of the spear where things are going. So here's kind of a quick rundown of my categories. So mission moments this month were 13%. Reimbursement challenges, warning signs, and implications were 10%. Competition to be aware of, that's 10%. Workforce challenges was only 6% this month. Patient, family, future customer demographics and trends, that was 19%. That actually was my highest category this month. Regulatory and political, after a couple of really busy months, dropped down to 4% this month. Technology innovations was 7%. Speed of change, resiliency, and reculture is 13%. Category that I call the human factor is 4%. And then my kind of, hey, this is Chris's article highlights of interest, that was 12% this month. So let me go through them real quick, Cordt. So under the mission moment, there is 9 articles there. And so I only wanted to highlight 2 for you guys, which, by the way, when you get the show notes every month, Jeff, our executive producer, takes the document that I'm actually reading from that has the stats, all the articles I'm highlighting. It actually is, it says, the headline says podcast news article, and you could literally download that each month. Court, something maybe we might think about is maybe doing like a little summary of your stats as well. That could be a download as we go forward. That might be an interesting thing we add to the show notes going forward. So under under Mission Moment, just a couple, Jimmy Carter, of course. And so that was one of your top clicked on. But obviously, President Carter passing away. And one of the ones I want to highlight was from the Atlanta Journal and Constitution. Jimmy Carter delivered a positive message about hospice care. Well, how did he do that? Actually, through being cared for by a hospice. Just a beautiful article talking about the powerful message to terminally ill patients and families is about the benefits of hospice care and choosing it earlier in your actual disease trajectory. And then only one other in this category of mission moments that I wanted to point out. Cord, you actually just did this in the past week. I'm like, I did not know this. It was January 27th, International Holocaust Remembrance Day. A little known story about a Jewish refugee in Dom Cicely Saunders. Did you know today's modern hospice movement was born out of the terminal illness of a Polish Jewish ghetto refugee and his lasting influence on the young Cicely Saunders? And upon this gentleman's death in 1948, he left money for her to create a new place for peaceful dying. And then in 1967, she opened up St. Christopher's of Hospice. I love history. I did not know that was actually part of her story. That was super cool. Thank you for highlighting that.
Yeah, I didn't know the connection there either. That was something Joy kind of pulled out of her archives, and I found that amazing.
Yeah, very cool. Again, I love history, and we better never navigate the future if we understand our history, and just knowing that came out of World War II, that's just amazing. All right, so my next category is reimbursement challenges, warning signs, and implications. There were 7 articles. Let me highlight a couple. So I usually break those into 2 subcategories. The first is just general to hospice. Comeaux, Hawaii, Medicaid palliative care services benefit. Hawaii now has a palliative care benefit under Medicaid. That's a big deal, guys. Tori Fields, who we did a great podcast with towards the end of 2024, is very instrumental, and she is laying the tracks on that to happen in several other states as well. So please make sure you check that out, and kudos to our friends in Hawaii that are now living within that. The other, and I'm going to ask you a question about this, Cord, just a little bit later, the HOPE Assessment Tool Series, Understanding the Required Time Visits. This was a chat blog by Jennifer Kennedy. I think HOPE is something that I really hope is on everybody's radar, because I think it's going to really change our future. And Cord and I are going to talk about that when we finish going through just the stats, et cetera. The other subcategory is Medicare Advantage under reimbursement. And so there are 3 below. I'm just going to read the headlines and you could draw your own conclusion. I won't make editorial comments. The first one, United Healthcare taught us ways to deny claims, says a former employee. This was in NBC News. Another one, CMS gives notice of a 4.3% pay hike for Medicare Advantage plans. And then another one, United Healthcare mounts a full defense of its business in wake of Thompson's killing. We all know in December, the assassination of the CEO of United, and just the half our country was celebrating that, and which is, you go, what is that about? And there was a great article in December just about, you'd think it'd be a huge wake-up call when half the country is celebrating the assassination of a CEO, which is horrible, but there is probably an interesting lesson to be learned in that. So again, I won't make any more editorial comments, but those are 3 I wanted to call attention to. My next category is competition to be aware of. There were 7 articles in total. I want to read the highlight or just a headline of 6 of them. Some wary of Providence Home Health joint venture with for-profit company. Some nurses in the state, and so this was in Washington, say an upcoming joint venture between Providence Home and Community Care encompasses a for-profit company with private equity ownership could have an adverse effect on healthcare. Some nursing advocates worry that a for-profit private equity influence could be harmful for healthcare. So that's what I want to point out there. And then under the mergers and acquisitions subcategory competition, here's just a few I wanted to point out. Hospice M&A market to return to sanity in 2025. And then in that article, it talks about some of the prior years, just where valuations and also just a flurry of activity was through the roof. So I think they're basically saying return to sanity is not crazy, not really low, kind of in the middle, kind of in that Goldilocks zone is what this one was predicting. Another article, Hawaii Palliative and Hospice Care Collaborative forms to strengthen advanced illness across the state. Love many of those folks are involved in that. And so it was a great quote from Brenda Ho. By coming together, we're amplifying our voice, strengthening our resources. And so you go, gals, that's awesome. Next, Amedisys halts the sale of home health hospice locations to Vital Caring. That'll be interesting to see. There's a lot of Department of Justice scrutiny, SEC scrutiny about the whole merger acquisition of Amedisys and LHC under United Healthcare. And then speaking of United Healthcare, last one in this section, United Health is named the world's largest insurer for the 10th straight year. And so we know the behemoth that United is. So next category is workforce challenges. There are 4 that I highlighted, only 2 I wanted to cite today. And I just want to read you the headlines, 2 really interesting ones. Virtual nursing could upend traditional staff ratios, which I think is going to have to be part of our solution because it's a math problem. We won't have enough staff compared to the volume of the silver tsunami of baby boomers. But let me just read from here. About virtual team-based nursing services, the term nurse-to-patient ratio is an anachronism, according to nursing leaders at Providence and Trinity Health. But with the traditional primary nursing model, a mountain of research demonstrates how low nurse-to-patient ratios bolster safety and quality of care. In fact, there were some articles actually backing that research about those ratios and the impact of quality. However, as the new virtual programs emerge and pick up steam, new research indicates that virtual nursing models improve communication, safety, and quality without assigning a ratio. So that's kind of interesting. In other words, the technology is enabling us to spread staff over more patients and not sacrifice quality. And I think that is going to be part of the absolute, we're going to have to figure that out as we go forward in the future to solve the math problem. So one more understaffing or workforce challenges. Climb aboard the jungle gym. Career path need not be linear to be successful. This was in the Journal Gazette in Fort Wayne, Indiana. Today's ever-evolving professional landscape, more women are realizing that their careers don't have to follow a linear path. Instead, they're embracing the concept of a career jungle gym. It's a metaphor introduced by Sheryl Sandberg in her book, Lean In. Unlike a ladder with one direct route, a jungle gym allows for lateral moves, creative pivots, and even deliberate pauses, all of which can lead to success. For women and nurses in particular, this mindset is transformative. So I highlighted that, Cord, because that's going to have to be part of the solution as well. We're going to have to get really creative, and it looks like that's also what especially working moms, et cetera, that happen to have nursing degrees are looking for going forward. All right. Next category is patient family demographic trends. That was one of my biggest ones. At 13 articles, only 7 I just want to call out, just the titles, because they're really so interesting. And I loved our show that you and Mark and I did, and we did our predictions for 2025. Well, guess what? CNN, human composting is rising in popularity as an earth-friendly life after death. Another one that we actually cited in our predictions, this is in the San Diego Union Tribune. As drugstores close, more people are left in pharmacy deserts. So that was another prediction that we made. Let's see, a couple more I wanted to cite. This was interesting. It's kind of a mixed bag. New inpatient centers unveiled as other hospice programs consider closure. So in some markets like Vitas opened 2 locations. Alliana Health reopened their hospice facility. So some openings, some closing on the hospice inpatient side. Here's another. Best-selling author, I asked 26,000 people around the world their biggest regrets, and these are the top 4. Foundation regrets, boldness regrets, moral regrets, and connection regrets. And here's kind of and this is by Daniel Pink, of which we've actually reached out to see if he'll be on our podcast this year. We'll see. The key is to not be stuck in regret, said Pink. So you think about, the impact of, we only got one life to live, and so no regrets. That reminds me of, my kids love the movie. I can't remember, but it was Robin Williams, and he got smashed and he got a tattoo on his chest, and it was supposed to be no regrets, but it was no regrets because they misspelled it. That's what I think of when I think of that one. Here's another one. And so I was going to cite this one, and then I forgot about it. I'm being funny. United States dementia cases estimated to double by 2060. The anticipated jump, especially large for women, also African Americans and those over 75. So dementia cases, percentage of population, it looks like America is predicted to be 42%, more than double the risk reported by other studies. So that's a demographic trend that we're going to have to keep an eye on as we go forward. A couple more into the section. This is from KFF, and this is a poll that the Kaiser Foundation, and I always feel like these guys are leading edge. In fact, I usually try to have a call with them a couple of times a year. And at some point in time, we might try to get them on the podcast. Medicare spending and insurance claim denials are the top concerns of people. You know, this wasn't in the top 5 of the presidential election, Cord, but it's going to be interesting. It is top of mind for people, though, still based upon this survey. And then overall spending, in which that actually was a pretty big jump. I think it was 8%. We had cited that in December news stories. And then insurance claim denials. And again, we talked about the assassination, 90 Care CEO, and then the bullet actually had deny, depose, defend on the actual bullet, and that's what it was poking on, was this insurance claim denials. Last one in this section, this was an AARP. Where have all the doctors gone? The average wait for new patients to see a physician is 26 days, and that's for most healthy people. And a medical emergency situation can be even more frightening. 22% of acutely ill 65 or older sought medical help, had to wait 6 days or more for an appointment. So that's another disturbing trend as we go forward. All right, so that's our demographic trends. Next category is regulatory and political. That was a little bit quieter this month, only 3 articles, only one I want to call out. And Court, I want to circle back with you on that one and ask a question. But this was MPHI supports lawsuit to ensure a proper implementation of the SFP special focus program that talks about Texas State Association, Indiana, of course, the Association for Home Care and Hospice of North Carolina, also South Carolina, the Houston Hospice, all have kind of joined in this lawsuit related to the SFP. Right, next category, technology and innovations, had 5 articles, I only want to call out 3. DC is America's loneliest city. In fact, Cord, my favorite president is President Truman, and one of my favorite quotes of his was, if you want to have a friend in DC, get a dog. But I guess there are not enough dogs, because can 1,000 robotic pets help? This was in the Washington Post and talking about basically our friends at Capital Caring and Steve Cohen and their All Companion Pets program, or Robotic Pets, Joy for All Companion Pets. And so, and I think they partner with Ageless Innovation, providing these robotic pets. So that was a fascinating article. Thank you for highlighting that one. Great news in North Carolina. I wanted to highlight UNC, which is kind of cool, and Duke, which is like, major rivalries in basketball, football. They're coming together and they're going to build a children's hospital, which will be very innovative. And it's going to be a 500-bed children's hospital somewhere in the Raleigh-Durham area. And that was in Modern Healthcare. And then last one in the technology section, how to prioritize AI initiatives. That's another area I want to circle back with you on, Court, is just technology. How to prioritize AI initiatives, a strategic framework for maximizing return on investment. That was a really great article. All right, my last couple categories. This one, speed of change, culture, resiliency. I had 9 articles. I only want to call one out on our podcast here. To build a strong leadership team, you have to invest in the middle. And of course, the reason why I want to point that out, we've seen this in the work that we do in Telias. Our middle leaders, first off, have the toughest job. They have it from on top, hey, this is where we need to go, but then just the day-to-day crisis of staffing and patient crises, etc. And this article in Forbes is just talking about the middle is going to make or break you. And we see this in hospice and palliative care programs. And so how you invest in those leaders, tools, resources, leadership training is pretty critical. All right, last 2 categories, the human factor. There are 3 that I actually cited, and I just want to read the highlights of all 3. This was an Advisorpedia, Living a Life Without Regret, What Final Reflections Teach Us. So another one on regrets. This next one, John Hopkins Medicine CEO, Bring the Joy Back to Medicine. I was in Becker's. Really great article. Made me think of Patch Adams, actually, whenever I read that article. And then third one, if you overcome these 9 challenges in life, you are more resilient than you think. This was in Personal Branding Blog. Really great article about just resiliency, and the 9 challenges were just priceless. And I'll leave it at that, because now I'm going to make you curious to want to go and actually look at it. Last category, Court. So These are just ones I want to highlight. There are 8 in the whole section. Only 6 I'm going to read the highlights. And I find this interesting. We didn't go back and kind of talk about our predictions for 24, but one of the ones I kind of predicted, almost, I hate to say hope, but like they got to look at United Healthcare. And actually, it was in Becker's, an unimaginable year for United Healthcare. You never wish ill on anyone. I certainly don't. But they sure had a tough year. And in some respects, I think we look at United, certainly we want to have a relationship because the number of people insured by them, but they are a 2,000-pound gorilla within healthcare, and you want them to use that 2,000 pounds of girth for the betterment of healthcare. So it'll be interesting to see what happens in 2025. Next one, from immortality to ugly people, 100-year-old predictions about 2025. I love that you called this one out, that you cited this one. It was an Akron Beacon Journal. Nearly 100 years ago, a group of deep thinkers dared to imagine what life would be like in 2025. Some of their prophecies were off target, while others proved to be weirdly accurate. And then we highlighted those. And so again, I'll leave you hanging on that one, make you want to go and actually look at that article. You guys are missing some good stuff. That's why we do this podcast. We don't want you to miss them. This was in Hospice News. Hospice CEO's top predictions for 2025. I love that, Cord, because when I looked at it, it was very close to the predictions that you and I and Mark made. And we also did commit that we're going to come back in the beginning of 26 and kind of grade ourselves and see how well we did. Just that'll be fun. This next one, Trump freezes HHS communications. This was in Modern Healthcare. And so I don't think I had this term when we were in there, but I feel like conceptually we're in the ballpark. But one of our board members coined this term, and I'm using it frequently. 2025 is going to be a predictably unpredictable year. The Trump administration has definitely shown that from the get-go, so it's going to be an interesting ride this year. This next one I love. This was from Stillwater Hospice CFO, a winning recipe for improving rural hospice care. That was in Hospice News. That was a great article because our friends in rural hospice have a lot of unique challenges. And then the last one made me think of our mutual friend, Dr. Ira Bayat-Cord. We need to talk about hospice. This was in Med City News. This is a really great article. In the quiet corners of healthcare, there's a conversation needs to be had. It's a conversation about hospice and just talking about the for-profit, nonprofit. What is the definition of quality? We need to have a conversation about hospice. So those are the ones that I wanted to highlight today. Again, all of our listeners, you can click on the link. You'll get that whole table, has the stats I mentioned, and actually has the articles that I cited. Some of them, I think probably about 30% were absolutely within Cord's top 10, but about 70% were not. So you got any questions from me after listening to all that?
You know, you do such a great job covering the content and the articles. There is such a volume of information that's out there. And it occurs to me that last month's podcast, you mentioned the challenge leaders face in filtering this vast amount of information to identify what's most important. That resonates with me as well. At Hospice and Palliative Care Today, we review between 1,200 and 1,500 articles daily to select 15 key stories for our readers. And even then, 15 articles can be overwhelming, hence the podcast to highlight critical insights. And as you're going through the 70 articles this month, usually, as you say, it's around 100, even that, I mean, it feels like sipping from the fire hose. There's so much content there. I appreciate the 10 categories you've developed to shape discussions on hospice care trends, such as mission moments and reimbursement challenges. Joy and I have explored similar structure from a newsletter perspective. We started with Mark Cohen's original categories, hospice news, clinical news, regulatory news, and we have about 18 broad categories that we're continually looking at and evaluating to determine the best way to organize information effectively for the readers. So I do have a couple of questions for you, Chris. Your first category, mission moments, that aligns with our focus on compassion-driven stories. It aligns with the hospice philosophy of care. Could you elaborate a little bit more on the significance in hospice care and its impact on listeners? How do you determine what stories fit into this category?
That's such a good question. And I'm sitting here just processing what you said, and 1,500 to 1,800 a day. I'm just picturing like this huge funnel, and you guys are doing this huge environmental scan, and then to think of what you highlight in your newsletter, and then what you and I then further distill down to highlight on this show. It's just incredible just to sit here and process that. And then again, we do this in service of the amazing hospice and palliative care leaders. But in direct answer to your question, like the mission moments, there's something that Mark said, it might have been 2 years ago, that, of course, I came into hospice in 1995, and this amazing community ownership, like most communities love their hospice, especially the community-based nonprofit hospices. They're connected to the community. And I can look through the rearview mirror of my time at Four Seasons Hospice in the Asheville, North Carolina area. And we have these beautiful stories when we were still doing print media, when you're still putting your hands on a newspaper. And most of those newspaper stories, almost once a month, were just these beautiful stories that we would call mission moments. I think you talk about like you're looking for the compassion, the pictures of compassion. We just happen to call those mission moments. But Mark was talking in one show about what is the impact when you no longer have those local newspapers, and therefore you're not getting that local coverage. That settled upon me because I realized, wait a minute, I inherited so much as a hospice CEO, and then we furthered it through those stories, and then that shows up in people choosing our hospice, donations, etc. So it maybe made me more attuned, Cordt, as we go through what you guys are highlighting. Those ones that are those mission moments, those pictures of that compassion. Hospice threads itself into the fabric of a community unlike anything else. I'm thinking of our mutual friend, John Master-John, and their hospice in South Bend, Indiana. I got to go on my sabbatical last year. Their campus, in some respects, was part of a Renaissance renewal of their community. That's a cool metaphor of what I've always believed about hospice, that there's something about this that impacts people's lives in just profound ways. And sometimes it's hard to even put words around it, which is why we call them mission moments. So I'm very attuned to them. And when I see them, I want to call them out. And maybe it's holding on to that fact that this is how we got here. And I don't want to lose that as we go forward into the future. Now, it's also lit a fire under my butt, Cordt. I'm still shopping this idea. We are a gold mine of those stories, but we don't have that local newspaper anymore. And so is there an opportunity amidst that? Like, what if there's a reality TV show of some of these amazing mission moments? That's an idea I've actually talked to someone in Hollywood about. Haven't landed it, but at least like, wow, that's an interesting concept. Especially on the heels of the John Oliver special. That just really it pissed me off. I'm just going to say it. And I get it. He's, he takes stuff and that's kind of how he creates entertainment. But it also took a very small sliver of this amazing movement that is hospice. And I thought, wouldn't a great antidote would be something that's much broader? So you really kind of lit a fire in your question there, a lot there. Does that provoke any comments from you?
It just reminds me of the humanity of what we're doing in hospice. And I think of a couple of different stories. I remember when I was on the ethics committee at University Hospital, we'd sit down and we had a room, a bunch of people, and we would sit down and start going through the agenda. And then I joined an ethics committee at a Catholic hospital. And prior to getting into the agenda at that organization, they would have a morning reflection. And I thought, well, how cool is that? Like, how would that work at university? Because it gets to that humanity. I know one of the hospices that I work with, when a patient dies, they will put a flower on the door. They will light a candle. They will in their inpatient unit, they will let the room rest for 24 hours before admitting another patient into that room. It's all about the respect for that patient and their life. And I thought, that's so wonderful. And But not all hospices do that, and not all providers have that moment to reflect on the humanity of what they're doing. And I wonder if there just aren't opportunities to incorporate that more, because this is intense work. It's hard. It's emotionally draining as much as it's emotionally encouraging and exciting. But we've got to take care of ourselves, our staff, and recognize the importance of this. And I think it's cool that that's the first category that you have listed. It got drilled into me years ago. Order is important. What's first is first for a reason. And that's why I wanted to ask, why are mission moments first for you?
You actually bring up a couple additional thoughts, and you nailed this, exactly why it's first. In fact, many of the hospices we work with have codified ritually what you just said, like starting a board meeting, starting a staff meeting with those mission moments. And it's great because I see that now, whereas maybe we're early fire starter, whereas now it's becoming more and more a norm. The other thing that strikes me, my mentor was Dr. Lee Thayer, kind of was a human Yoda. What made him so fascinating is he read across the centuries. And one of the things he used to say that tweaked me in a good way, he was an admirer of the Japanese culture, that many cultures use tradition and rituals and stories to shape the culture. And kind of in vogue since the 60s is like, let's just throw off everything. Well, maybe that's good to rethink some tradition. There are times of evolution and change. But if you throw all the baby out with the bathwater, that's not good. And I think we're one of the aspects left in our culture where rituals and tradition, as Americans, we're kind of death denying, and it's very present to us because of this work that we do. So to have rituals and traditions within our own hospices in a way that, as you say, honor the humanity, honor the passing of someone's life, their whole story that occurred, I think that does something to us, or it has the potential to do something to us, which is super important. I think we live at a time, right, that it's all about, well, what do the numbers say? And I love Daniel Pink's book, where actually we've reached out to him again, see if he'd be on our podcast, A Whole New Mind. He's kind of predicting like we're about ready to go into more right brain world than left brain world, because left brain world has been like data, accountants, and it's not you're throwing the baby out with the bathwater, but maybe the future of humans is more that right brain creativity. And I feel like that's the world that when I came into hospice, I literally felt like Dorothy and the Wizard of Oz, because I grew up in corporate America. I'm like, whoa, what is this? But in many respects, I feel like it's maybe saved me, recovered my humanity. Now, I didn't throw the baby out with the bathwater with the accounting and the financials that I learned, but it's a tool in the toolbox and this broader cause and purpose that we're a part of. And that's kind of where I'd land the plane on this, Court. It is about cause and purpose. And we have a beautiful cause and purpose in this work that we get to do, that we're privileged and honored to do every day.
Like I say, it's that left brain, right brain balance. I had another question for you, and this falls into your regulatory category. And that's that the CMS Hospice Special Focus Program stands out as a major issue for 2025. We ran a story on December 29 with the original announcement from CMS. It described their methodology, why they were identifying poor performing hospices, and it included a list not of the 10% poorest performing hospices, which is where they began, but they rather is a much smaller list of the initial 50 poorest performing hospices. So I'm thinking this is an incredibly important story, and we had about 900 reads, so kind of a mid-tier readership of that story. But subsequent coverage of the Special Focus Program, such as the Alliance's analysis of implementation and NPHI's support of a related lawsuit that you commented on, those had even more reads. Like the Alliance's analysis had 1,800 reads, NPHI's support was around 950, and it occurred to me that people are maybe they're reading more about the backlash than they are the original statement, the original announcement. This is why we're doing this. This is how we're doing it. What's your perspective on that from a C-suite?
Yeah, I know where most of the people are listeners, but if you were watching the video, I'm gonna bang my head on the desk here because where you just landed it, it's like, wait a minute. anyone who's in hospice and palliative care space for the right reason, I don't care, for-profit, nonprofit, you're in for the right reason to do good work. How could you be against highlighting programs that are in it for the wrong reasons? And there's a percentage that we're like, you need to highlight that. That's the whole point of having a special focus program, is to call out that stuff. And then now all of a sudden, like the headline is, well, that's bad. Wait a minute. And unfortunately, we live in like the drive-by. It's got to be a cliche. It's got to be catchy, etc. And I, like you, am concerned we're losing something in this. Now, I get, because I've actually had people reach out to me and go, what the hell's up with this lawsuit? Why are they doing that? So here's the answer that I've gotten is, number one, and Judy Lund-Pearson was great last year. I did not realize about 50% of hospices in America do not have CAP scores because of the size of their hospice. In fact, sometimes I'd say, yes, maybe that national brand entity, they look big, but if you go to the local level, they're a series of little 30 patient day hospices. I'm not dissing that, but in reality, they're a roll up of very small programs. And then if you go down, if you want to get really in the weeds, get down to that provider number level, that's another way they escape scrutiny, is because it's kind of firewalled in all these little small programs. And so there is something needs to be done about that, because if 50% are not having patient satisfaction scores, and we live in the Amazon world, right? We all go on Amazon and look at the 5-star rating, and you don't have that on 50%, that is an issue. I agree 100%. Second thing is, because of some of the concern of programs, hey, surveyor, you're going to go find something. Well, I grew up as a financial auditor. You got enough rules. Show me the man. What does the Russians say? Show me the man, I'll show you the crime. If you're going to tell a surveyor to find something, they're going to find something. And then if you're going to take that something and now you're going to say, well, okay, well, look, you had a something, so now you're on the list. That does seem to be an issue. And maybe the core is, how about consistency in survey? Not just finding something. Let's find the most material things that would tell you there's an issue with quality of care. So I get those things, Cordt, but I thought I heard you, and maybe I misunderstood, that you've kind of replicated their algorithm the best you can, and you think it's a pretty legitimate measure. Did I misunderstand when you said, did you say that, or did I manufacture that in my brain?
No, I said that. We were talking at a different presentation around the methodology that they're using, and there are questions around it. Like you say, the surveyors have been told for several years, see one, cite one. You see a problem, you write a citation. And so I understand some of the question around the methodology. On the other hand, from a CMS perspective, if you're trying to limit waste, fraud, and abuse, you're trying to get rid of the, when I started in hospice, I thought it was about 5% bad actors. And now I actually ask people, like, how many bad actors, what percentage of hospices are bad actors? And I leave that a very loose definition on purpose. It's like 25 to 40%.
I would have said a third. I would have guessed that probably a third bad actors today.
And that's astounding to me. And so I appreciate that Medicare's trying to do something about that. If that's the special focus program, if that's program integrity, however they're doing that, and putting some restraints, putting some guide rails on, so that we can keep the integrity in hospice where we began.
Well, I think you and I predicted when we did the show with Mark to open the year that I have a feeling we're going to be talking about this throughout this year. But like you, I've kind of walked away to go, wait a minute. Now the perception is the lawsuit, which means that scrutiny is bad, but yet, and I actually had to reach out to people I respect and said, help me, because I had people calling me going, what the hell? And then now I understand more of the details. And so, and again, we live in kind of give me the soundbite, and this is a hard one because it's a bit complicated, but let's not lose the fact that we need to do something to highlight that 1/3 that are not in it for the right reasons. Typical business, right? If you're a crappy restaurant, the word of mouth is going to get around, and eventually the market's going to punish that. This is a really tough one because you don't get do-overs in hospice. And the typical consumer thinks the word hospice is like Kleenex, like a hospital. And so not all hospices are the same. A third are not. So maybe you and I will keep using this bully pulpit to at least pound that drum, and eventually we'll get to a good place. 50% of hospices don't have a satisfaction survey. That's unacceptable. So let's do something about that too.
Yeah, I started with the National Hospice Locator back in 2012, just a national directory of every known hospice location, and the default sort on that was largest to smallest. Just thinking the larger you are, the greater capacity you have for breadth and depth of services. So not a horrible measure, but not necessarily a great one either. So about a year and a half ago, I created my own metric to give a quality score to every hospice in the country, and now the default sort is highest quality to lowest. And we can talk about and change and make edits to the method that I'm using, and I look for that kind of feedback. But I'll tell you, at least once a month, I get an email or a phone call from somebody in the world that like I don't know, but they've used the National Hospice Locator as a family member, and they reached out and said, thank you for doing that, because I'm in Houston and I have 100 hospices to pick from. I don't know who's good or bad. Not to say that I'm the final authority on it, but I'm trying to help the consumer figure this out. And we can approach that from the high quality perspective, or like the SFP from the poorest performing. So there's a lot of angles.
That's great. You actually gave me an idea that I'm going to circle back with you on. Well, we're going to run out of time for me to get to all my questions. So let me pick out of the two. So I had a question for you. Do you think this is going to be a pivotal year, that the acceleration of technology and its impact on things? Like, maybe another way to ask the question is, artificial intelligence was kind of a novelty, but maybe beyond a novelty next year. Is this going to be a year we're going to look back? Like, I can remember when the internet, and the very first time I was on the road traveling and sent my wife an email, and just, wow. And then how then it took off. Are we in one of those pivotal years for technology, do you think, this year?
Wow, what an interesting question. I really believe we are. I believe 2025 will be a pivotal year for the acceleration of technology, both in terms of development and implementation. So the rapid emergence, and in some cases disappearance, of new AI products is expanding the range of available options, each offering unique features. Additionally, I think there's a growing willingness among users to experiment with these technologies despite concerns around data confidentiality and security. As people continue to evaluate the risks and benefits, we're seeing increased adoption driven by tangible advantages in these that these innovations provide. Like you say, using email the first time. I remember the first time I went to a gas station and paid by credit card at the pump. Like, can I trust this? Is this okay? And I monitored my credit card statement for 2 months to see if it got abused. And it didn't. So I used it again. And now, like, we don't even think about going inside to pay. So again, it's that adaptation, the adoption of these new technologies. I recently tested 3 different AI-powered virtual meeting note takers. So you're probably familiar with that. The listeners are familiar. It creates an executive summary. There might be a transcript, verbatim of what happens. So I compared these 3 different tools that had different features and different pricing. Some of them stood out as significantly more effective than others. After careful evaluation, I selected one of the 3 for further in-depth testing, and I use it on almost every meeting now. And while there's a minor risk that these meeting transcripts could be accessed, the likelihood's really low, and frankly, the content would be horribly boring to anybody outside of the immediate discussion. So I think this is going to be a year not only of acceleration of technology, but the adoption of it in hospice and palliative care circles. We're not the highest tech group, but I think it's coming. I think it's just going to unfold, and as capital carings using the robotics as a clinical measure for patients, I think we're going to see more and more. What's your take on it?
Yeah, I agree with you. I can't remember the year. I think there's a pivotal year, beginning of 2026. I don't think it's ASI yet, or which is artificial superintelligence, but maybe it's AGI, which is artificial general intelligence. And so that's a whole nother level. I think I've heard the analogy that I think it's AGI. At that point, if you take like 8 billion smartest people in the world, that's what's kind of packed into AGI. And then I guess ASI is like, I'm thinking of that movie with Johnny Depp, Transcendence, where he uploads himself into the internet, which is like, or another one is Eagle Eye. Those are like, kind of dystopian, but also like, wow, where's this thing going? But there's some pivotal points that are not too far in the future. So I agree with you. I think it's going to be a fascinating year. There's a scary side to it, but there's also the necessity side, like that article that I cited, that there's not going to be enough staff. So how do you blend technology, take the staff that we have, put them right care, right place, right time, which is more aspirational than it is reality right now, which is where then we need tools like this. So again, I have a feeling we're going to be talking about SFP. I think we're going to be talking about technology. One we don't have time for today, but I'll queue up next month, Court, is the Hope tool. I want us to talk about that. And just because you've just did an amazing presentation for our network on technology, why don't next month we have you do the master's class on that? Does that sound okay? Awesome.
That'd be
Well,
great.
speaking of master class, so Mark Cohen started something last year, and we're going to keep that up. So Cord and I are going to kind of trade off, and maybe we might bring Mark back for 1 or 2 this year. So I'll take this month's master class. And the concept that I want to talk about is need to know communication. And so just being very succinct, what is need to know communication? My mentor, Dr. Lee Thayer, taught it to me. Need to know is very simply this. In as few words as possible, you can pay forward to other leaders what they need to know to perform their roles in the organization. Great concept, really flippin' hard to do. And what need to know is predicated upon is we understand each other's roles. By the way, that's why Court and Joy do the work that they do. And then we do this podcast, because knowing what's coming is absolutely need to know communication. Or maybe better said, what you're partaking of, think of how big the funnel is of what they're scanning. And they're like, hey guys, don't miss this. That is feeding your brain. And then that helps you go, hey guys, on my team, this is what you need to know about what's coming, but then also what's happening on a day-to-day basis. How we normally practice communication. There's a horrible scene in Lean on Me. Stand By Me. Sorry, Stand By Me. And there's this kid that's brilliant in how he tells stories. And he tells a story about this kid that was picked on and bullied. And he goes in this pie eating contest, and he also drinks a bunch of castor oil, and he basically vomits all over the audience. It's a very graphical scene. And I say that graphically because that's how many people practice communication. I don't know what you really need to know, so let me just vomit all over you. Like Court would say, you know what? I don't know what you need to know. I'm just going to pass along 1,500 articles to you every day. Good luck with that. Let me know how that works. No, he does a good distilling process, and we further distill here. So we're actually trying to practice need to know communication with you guys. But how does that work within your own organization? In fact, we have a great tool called Prow of the Ship Questions. Court, if you think about it, patient satisfaction, financial data, that's all the wake of the ship. The ship's already plowed through the water. When you're looking at that data, it's the wake of the ship. So these Prow of the Ship questions actually came from a master's in leadership course with Dr. Thayer. He actually said, the problem with you and most leaders is you're just looking at the wake of the ship. And I was the one brave soul and said, okay, if we're on the prow of the ship, what are we looking at? What are we asking? And I took his answer, and we've actually built a tool. What that's doing is building a muscle within leaders to better distill what's coming, to go, hey guys, we need to know this. We need to know this. And then you could pay that forward. The other part of the equation to practice need to know is lexicon. Lexicon is not the little green guy at the end of the rainbow. Lexicon is an organization's language that we use. The opposite of lexicon would be cliche. Oh, we're about excellence in healthcare. Well, what the hell does that mean? Lexicon is that we've actually vetted the words, and the words have deep, rich meaning. In fact, we always say when we're assessing an organization, I'm listening to their language because it tells me a whole lot. If you're loose with your language or cliche, Dr. Thayer always said that we create our meaning in the words that we use. And that actually even goes back to scripture, that literally the tongue is like the rudder on a ship. So lexicon is the words that we use to communicate with each other. within the organization. That also helps quite a bit with need to know, because an organization has taken the time to have a lexicon. You communicate much more effectively and efficiently in fewer words as possible. And then, like anything in life, you have to practice it. So one of the things that we do in TCN and we teach our members, Cordt, is that every week when we tell each other our priorities, we call them big rocks. We also try to graph in, hey, this is need to know. In other words, these are things that happened last week that I got to pay forward to you. That creates that muscle of need to know communication. Now, people go, well, what about just, having fun and talking? Like, that's great. We don't want to get rid of that. In fact, unfortunately, most organizations, it's kind of like, that's all that we do. Maybe all we're doing is shooting the breeze, which is great. You want to do that. But then when we're talking about the things that matter, are we actually talking about the things that matter, or are we just throwing a bunch of stuff at each other? So need to know is very simply, this is what we each need to know to perform our roles today, but also where we're going as an organization. And it is a competency. And like anything, you have to practice it over and over again within your organization. So that's our masterclass on need to know communication. Cordt, thank you for being here.
Fantastic.
This was really fun.
Well, I appreciate it. Thank you for taking some time to dialogue, to talk about why these stories are important. And it's not just what caught my eye. I think this is going to shape 2025. I think this is going to change hospice. And for that, like you say, being on the prow of a ship.
Yep.
That's a term I'm unfamiliar with, but being on the prow of the ship is incredibly important to guide our organizations.
Yeah, well said. Yeah, picture like the Titanic with Jack and Rose on the front of the ship. That's the prow of the ship, not the wake of the ship looking out the back. Well, I can't wait to keep doing this monthly. So you and I will be back, and we'll do the top news stories of February, and it'll be here before we know it. To our listeners, thanks for listening. Subscribe. Make sure you pay it forward to your coworkers, anyone you think they'd benefit. We do this show in service to you. There's a lot coming at us, and we live at very interesting times. And I think these next 3 to 5 to 7 years are going to be fascinating, which to me makes this intelligence gathering that we're doing, reading Cordt and Joy's Hospice and Palliative Care Today newsletter, very important. And as we always do, we always want to leave you with a quote. This one I got from Cordt's Hospice and Palliative Care Today. It was on January 26th. It happens to be my favorite poem in all the world. In fact, I included it in my book, The Anatomy of Leadership. It's by Rudyard Kipling. And this is just one stanza, you can keep your head when all about you are losing theirs and blaming it on you. You can trust yourself when all men doubt you, but make allowance for their doubting too. Thanks for listening to TCN Talks.